we're going to cover the parts of the respiratory tract. We'll look at all the models we have here showing parts of those. But first, let's go over the entire respiratory tract. In other words, the flow of the air in. Remember, we want to get oxygen in. So the major structures here on this torso model are, of course, we got to get the air in. So we're supposed to breathe through our nose, but some people do breathe through their mouth or both. But the mouth is really considered part of the digestive tract. So we're going to cover the nose as the beginning of the respiratory tract. The nares is the hole that the air goes in. Ouch. And then the air enters the nasal cavity. Now, once the air goes back horizontally in the deep nasal cavity, you can see it's like halfway back through your head. We're about halfway through the head before this respiratory tract turns vertically. When it turns vertically, it's now the pharynx. So nares, nasal cavity, turns vertical, the pharynx. Even if you breathe through your mouth, air is coming in that deep oral cavity. As soon as it turns vertical, we got the pharynx. Now the air is going to continue down the pharynx, and it's going to enter the larynx. Now you just see the external structures of the larynx here. This is the hyoid bone, and this is the thyroid cartilage. They're part of the larynx. Now once the air gets past the larynx, we're going to see these ringed cartilage structures. The light blue is cartilage. That's going to be your trachea. Now the trachea is going to go behind the aorta and vena cava for now. So we're going to take the heart off so we can follow the trachea down. And you can see the trachea is going to end. It's going to split. When it splits, they're called bronchi. One is the bronchus. Now the bronchus is going to enter the lungs, and they're going to continue to be various kinds of bronchi. There's primary, secondary, tertiary bronchi, until the final split of the bronchi is going to be a bronchiole, which just means a little bronchi. And finally, we're getting to where we want to go, deep into the lungs. And if you look closely, each one of these little circles are called an alveolar sac. Together, they're called alveoli. One is an alveolus, and they're actually microscopic. They're all over the lungs. Now we can take the oxygen inhaled and put it in the blood, because each one of those little alveoli is going to have blood vessels around it. That's the respiratory tract. Now, our bodies produce carbon dioxide as a waste. Remember that formula, aerobic cellular respiration, oxygen plus glucose gives you energy plus water plus carbon dioxide. So we got the oxygen in for the formula, we used it for energy, and we created energy and water, and we also have a waste product, carbon dioxide, we have to get out. So now the carbon dioxide is going to follow the reverse path from the alveoli, from the blood to the alveoli, bronchioles, bronchi, trachea, larynx, pharynx, nasal cavity, nares, out. All right, that's the respiratory tract. Now we're going to move over here and look at some more detail of these structures. So here's a sagittal head model. And let's see what we see here going on. A lot going on in the nasal cavity. There's our nares, this nasal cavity. Now in the nasal cavity, we have lots of blood vessels in the mucous lining. And that's to humidify the air, warm the air. We have these concha, bony protrusions inside the nasal cavity to kind of funnel the air back. We also have a lot of sinuses around the nasal cavity. You learn these sinuses: the frontal sinus, sphenoid sinus, the ethmoid sinuses. We also have a maxillary sinus that are going to produce mucus to cleanse the air here's a bony part of that. We had this monol. There's your frontal sinus would be here, your sphenoid and ethmoid there. If I flip this over, you have this giant maxillary sinus under your maxillary bone that you can see is going to feed into the nasal cavity there. So a lot happening in the nasal cavity. In the meantime, this little tube here would go out to your ear, this eustachian tube, to equalize some pressure. But anyway, we got the air cleansed and warmed and humidified. Now, when this nasal cavity turns horizontal, remember I said we now call it the pharynx. Now in the pharynx, we have some tonsils, which are going to continue to clean the air. And we're going to continue to have mucus linings all the way down this tract. I'll show you where the tonsils are. This one back here in the back of the nasal cavity are called the adenoids, also called the pharyngeal tonsils. And then we have one back here, right here, hanging off the palate. That's the palatine tonsil. And then we have one behind the tongue here called the lingual tonsil. I will just go over these structures at the floor of the nasal cavity real quick. This is going to be your hard palate with bone under it. And this is going to be your soft palate. And this protrusion of the soft palate is the uvula. Of course, that also makes up the roof of the oral cavity. And that's your tongue there. Now, the pharynx can actually be divided into 3 sections. That's pretty long too, isn't it? We call that the throat. Has to be vertical. So the 3 parts of the pharynx you're going to have to learn are the nasopharynx, from the roof of the nasal cavity to the tip of the uvula. The oropharynx, which is the part behind the oral cavity, so that'd be from the tip of the uvula down here to the tip of this protrusion, which is going to be your epiglottis. That's going to flip over here. But for now, this is the oropharynx between the uvula and the tip of epiglottis. And then your laryngopharynx, because it's behind the larynx here, would be from the tip of the epiglottis to the split, where the pharynx splits. Now, the pharynx is going to split into the esophagus posteriorly and the larynx anteriorly. So, we want to make sure that the air is going to go down the larynx anteriorly and not posteriorly in the esophagus into the stomach. How do we do that? Well, most of the time, the esophagus has a sphincter on top of it. It's closed. Esophagus is only going to open when you eat. So our larynx is wide open when we breathe. So the air comes down here, nasal cavity, down the pharynx, and it'll go right into the larynx. Now the larynx has 3 major structures. It has the epiglottis, which is a cartilaginous flap, elastic cartilage. And then we have the vocal cords here, false on top, pinkish, true vocal cords in the white. True vocal cords are the ones that give you voice sounds. The false vocal cords on top are another protective device. And then we have some cartilage of the larynx. In the front, we have the thyroid cartilage. We have some cartilage back here. It's going to be called the, also the thyroid back here. This is the cricoid cartilage here. Now, what are these parts for? Well, the cartilage is for protection and to keep the larynx open. We don't want it to close. Vocal cords, we already said. White ones, true. Inferior, create voice sounds. Superior ones, false, protection. In case something comes down here and gets past this epiglottis, it's not air, these false vocal cords can close and protect it from going down further. So the epiglottis is a protective structure that's going to close when you eat. So when you eat, as soon as something hits the back of your pharynx here, it causes a reflex for this epiglottis to flip over and protect food from going down into the larynx and trachea. So as part of that reflex, the esophagus opens, the epiglottis closes the larynx off, and the uvula actually flips up to close off the nasal cavity because we don't want food going up there either. Isn't that interesting? So then after the larynx, we have the trachea starting. As soon as you see these rings of cartilage, that's the beginning of the trachea. All right, that should cover that. Now let's go over here to this model. And here, we're getting into the trachea, okay? This is the larynx, and I'm gonna take that larynx apart here and show you some of the structures I showed you on the other model. But for now, let's just look at this. That's the hyoid bone in your neck. That's the thyroid cartilage. Again, you can feel that in your neck. You can feel that little dip there. Men have this protrusion here on the thyroid cartilage called the Adam's apple. Cricoid cartilage here. There's a little gap between them. And then we start the tracheal rings here. You should recognize that as the thyroid gland, endocrine gland there. We have some muscles there. All right, now the trachea is going to go behind the heart. So we'll go ahead and look at these lungs and take them off in a minute. As far as the lungs, while I have this here, I told you that the left lung is a little smaller because the heart protrudes onto the left side. So on the left side, we only have two lobes of the lung. We have the superior lobe here, and we have an inferior one here, and we have this little notch called the cardiac notch of the lungs. On the right side, we have three lobes, superior, middle, and inferior here. And the dividing lines are just called fissures. All right, let's see if we can take these off here. That came off good. And let's take the heart out. I'm gonna put this down just a minute so I can get these off. They're in there a little tight. Okay, now we can see the trachea nicely. It's trachea until it splits. So part of the trachea begins in the neck, but then the bottom inferior part comes down into the chest cavity. This trachea is lined with ciliated, pseudostratified epithelium, and it creates a lot of mucus to continue cleaning the air. Now, once it splits, we have the bronchi, and there's three levels. We have the primary bronchus is the first split. Now, as soon as that splits, here and here, we have the secondary bronchus. And as soon as that splits, we have the tertiary bronchus. Now, if that splits again, like up in here, we're going to call those bronchioles. Primary, secondary, tertiary bronchioles. After bronchioles, we have those tiny microscopic alveoli sacs, millions of them. You can see the little dots there. Now, we can see the diaphragm down here. Now I'm going to take you over here to this larynx model and see what we see here, particularly if we take it apart, because you have to know this larynx pretty good. But before we take it apart, hyoid bone, it's white. Light blue is cartilage, thyroid cartilage, cricoid cartilage, tracheal cartilage. Now let's take this apart and look at a sagittal cut. Okay. Let's look at this one here. This is going to be the epiglottic cartilage inside the pink epiglottis. Now this is a flap, like your ear, made of the same type of tissue, elastic cartilage. So flip your ear over and notice how it bounces back when you let it go. Hear mine? Same thing. When you eat, this epiglottic cartilage and epiglottic tissue will close over this opening to make sure food doesn't go down to your trachea and lungs. Now this opening here into the larynx is called the glottis. And that's where we got the name epiglottis, for the tissue or flap that covers the glottis when we need it to. So that's your first protection. Your second protection are these false vocal cords on top here. And then we have the true vocal cords, which are for talking. Then we have our thyroid cartilage here and our cricoid cartilage here. So again, the three main parts of larynx, epiglottis, vocal cords, both sets, and the cartilage around them. Here is a giant larynx model. How about that? Now what we see here, hyoid bone, thyroid cartilage, and their cricoid cartilage. And we see our epiglottis here. We can move that one. And we'll turn this a little bit. Now from the back and top, you can see that this is the epiglottis that would flip over the larynx when we eat. And it's going to protect food from going down there. And here are our vocal cords here. So let's just consider these as the false and the white ones as the true. Okay, so we can pull this little string and of course they can open. When we talk, the air comes out and gives us sounds. And muscles are going to do that. And they'll close when we eat or when we're not talking. There's the epiglottis flipping over. In the back of the trachea, posterior of the trachea, the tracheal rings do not go all the way around. This is a little posterior tracheal membrane here, we call it. And the reason for that is the esophagus is right here posterior to the trachea, and since that's going to expand a little bit when we eat, we got to have some flexible tissue in the back. Remember, these tracheal cartilage and the laryngeal cartilage is to keep the airway open. It's called keeping a patent airway, and also for protection. All right, let's move on. Here, this model is called the bronchial tree model. Again, we see the larynx up there, hyoid bone, thyroid cartilage, cricoid cartilage. Now the cricoid cartilage, you can see, does go around to the back here, whereas the thyroid cartilage really kind of just comes from the front and to the sides and then ends. And as our trachea comes down, we see that tracheal membrane here. So now we got the trachea here. Thyroid cartilage and larynx, cricoid cartilage, that's whole larynx. Then we have the trachea here. Now notice there's some ligaments here between the hyoid and thyroid cartilage, between the thyroid and cricoid cartilage here. And sometimes, particularly here, if they have to do a tracheotomy, if the airway is blocked up higher, then it's done in one of those membranes there. So tracheal cartilage comes down here. When it ends, the bronchi. Left bronchi, right bronchi. You can see the right primary bronchi a little bit shorter than the left, but they're primaries until they split. So let's start on this side. Primary, secondary, tertiary. Primary bronchus, secondary bronchus, tertiary bronchus. They don't really show the bronchioles on here. And then we have this, which is the alveoli model. Now this is microscopic, okay? Microscopic. So they took it enlarged into a model so you could appreciate it. And we're going to look at some slides of the alveoli under the microscope. You can only see them under the microscope. You have to take it up to about 100 power just to see them. But there's millions of these tiny alveoli here in your lungs, which is the last destination of the oxygen before it goes into the blood. So these tubes leading down to the alveoli, those are the bronchioles here. The light blue ones, which then they lose some of their light blue cartilage and they become the bronchioles, which we can dilate and constrict. And they're going to lead to the alveoli. Now, if we take a group of alveoli, we could call that a big alveolar sac. Each individual balloon, I like to call them, is an alveolus. So one is an alveolus, plural is alveoli. So your lungs are really a whole bunch, millions of tiny balloons instead of one giant balloon. And each of these alveoli is going to inflate. Of course, you don't have to use all of them all the time. Notice that each alveolus has lots of blood vessels, capillaries around it. That's where the oxygen is going to go, from the alveolus into these tiny capillaries to deliver the oxygen into the blood. Now these here are the capillaries bringing carbon dioxide back, because remember, carbon dioxide is going into the alveoli to breathe out, while oxygen is coming from the alveoli into the blood to provide oxygen to your body. It's a nice model of the alveoli. I often call each alveolus a little tiny alveolar sac, but some folks call the whole group of alveoli an alveolar sac. Sometimes I'll say alveoli balloon to indicate it's like a tiny balloon. The last model we have here is this happy little model that demonstrates how you breathe. Now this model is going to simulate several things. This cork here is going to simulate the trachea. The balloons are going to simulate the lungs. And you can see right below the trachea, there's two little extensions which are going to simulate the bronchi. This plastic dome simulates your chest. And this rubber piece at the bottom will simulate your diaphragm. Now, as we get into the physiology part, we're going to find that what makes you breathe is the diaphragm mainly. Now, if we look at this now, the lungs are deflated. They have no air in them. That diaphragm is kind of flat. It actually would be inverted up, kind of like a U shape. Kind of like this. Now, what makes us breathe is that diaphragm is going to move down, and it's going to increase the volume inside our thorax. When we increase the volume in the thorax, the air pressure in the thorax goes down. And when air pressure in the thorax goes down, the air pressure outside is higher, and it's going to rush right in. You're going to learn about Boyle's law that says pressure and volume do the opposite things. So I'm going to try to do this here. Let's see if I can position this phone. I don't have an assistant right now, so we can get this down. So I position it right here under this alveolar sac. Okay, hopefully it's going to stay. All right. Now, here, watch what happens when I pull this diaphragm down. See? They inflate. Because what I did was I increased the volume and decreased the pressure inside the thorax. Now watch what happens when the diaphragm relaxes. You breathe out. Because now we have low volume, high pressure, and we force the air out. You're going to make one of these models at home with a bottle, plastic bottle, and some balloons. And I'll show you instructions on how to do that. But let's look at it again. Diaphragm is relaxed, it's up. Now we pull the diaphragm down and the lungs inflate. Push it back up, deflate, breathe out. Just from the movement of the diaphragm. So know what the parts of this model represent and how the diaphragm is going to help you breathe. All right, that should do it. I don't think we have any more respiratory models. You're going to take a bottle like this and you're going to drink everything in it, of course. You're going to cut this bottom off. You're going to place a balloon, a cut balloon around the bottom to stimulate the diaphragm. You're going to take another balloon and put it on the top after you take this top off and put it in there. Either glue or rubber band the diaphragm, balloon diaphragm here, and you're going to pull down and push it back up. All right, I'm going to finish this. Drink.